Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment for the valves of the heart. Now, what are the valves of the heart? Is our mitral valve, aortic valve, pulmonary and tricuspid. Now, here we will discuss diseases of the valves which mainly include our mitral stenosis, aortic stenosis, mitral regurgitation and aortic regurgitation. Now we will discuss the Ayurvedic herbal treatment for all these types of diseases. Now, what is stenosis? Stenosis is a medical condition caused due to narrowing of the valve opening from the atrium into the ventricle. Now, this condition is usually caused due to rheumatic fever, congenital causes and chronic autoimmune disorders. The inflammation and resulting damage to the valves may become apparent several decades after the actual infection has occurred. While there may be no symptoms with mild stenosis, as the condition progresses and the valve opening becomes less than 1 centimeter square, symptoms of breathlessness, lung congestion and heart failure become apparent. Now, atrial fibrillation may also develop gradually. Now, what is regurgitation? Regurgitation is a medical condition in which blood flows abnormally in a reverse direction from the ventricle of the heart to the atrium. Now, valve prolapse, rheumatic heart disease, infective endocarditis, annular means round calcification, cardiomyopathy and ischemic heart diseases are the common causes for this condition. In the initial stages of this condition, there may be no or minimal symptoms, but as the disease progresses, affected individuals may experience breathlessness, lung congestion and heart failure. Now, what are the investigations done? Clinical history, physical examination, chest x-ray, ECG, 2D echo and cardiac catheterization may be required for an accurate diagnosis of these conditions. Now, again I will talk of common treatment for all these conditions. The conservative treatment includes medicines to prevent infection, reduce lung congestion, treat atrial fibrillation and prevent embolism. Now, surgical treatment includes valvotomy or valve replacement. Now, what is the Ayurvedic treatment for this condition? And when can Ayurvedic treatment be given? Ayurvedic treatment can be successfully included in the long-term management of stenosis as well as regurgitation. The goal of this additional treatment is to increase the symptom-free period by at least another decade or so, and to reduce the need for surgical treatment, improve quality of life, reduce the risk of complications and help improve overall long-term survival. Now, Ayurvedic herbal medicines improve heart function and efficiency, reduce the load on the heart, reduce lung congestion, treat fibrillation, and help reduce inflammation and calcium deposits on the valve, thereby making the valve leaflets more pliable. Herbal medicines act on the heart muscle as well as on the tiny tendon cords attached to the valves, thereby improving the valve functional efficiency and delaying further stenosis or regurgitation. Now, treatment for stenosis is slightly different from that of regurgitation, and the medicines are used in different doses for the two conditions. Ayurvedic Panchakarma treatment modalities are also used here, and the ones which are used most are Hriday Basti and medicated enema Basti. And both these treatment modalities are quite effective in these conditions along with the oral medications. Now, once the symptoms are brought under control, other medicines are used to increase the heart performance and endurance so that the overall symptom-free period is increased and overall lifespan of the patient too increases. The medicines required for each individual patient may differ and the dosages too required may be different, depending upon the overall medical status of each affected individual, the response to treatment and the associated medical history and complications. Now, initial treatment may be required for about 6 to 8 months, while a few medicines for maintenance may be required for another 6 months. Now, some patients with severe valve disease and who are declared unsuitable for surgery, they may require a few Ayurvedic herbal medicines on a lifelong basis. And Panchakarma treatment may be given occasionally or for short periods or short courses. So friends, this is a short description of Ayurvedic herbal treatment for diseases of the valve which include mitral stenosis, aortic stenosis, mitral regurgitation and aortic regurgitation. Let's meet in the next video. Goodbye.